na o how to atwa Dr. Richard Amu yene na bedi enkom. Doc.
Yes sir.
Yes say obi entume enwo a ase kire sen de na man basa.
Yo medase. Ma menchia wankasa ene watiefo nyina bebi obi a wotie me bia no wede nchia sonko free Capital Radio Studio. MOB bia. Eka say infertility am say brof puto yebeka say infertility and as will be intime wo. De change na ne say oba ene bema sabi omo aware me de aware for ye that's the ideal example I can give. And as oba ne bema te na omo pese omo nyensen. Se ka so mo ye infertile I was say omo tena bom I was say abrano nyina omo di ehia me ka say nhia mu a sabi puto me ka say they should be having regular unprotected penile-vaginal intercourse. So them can you say oba ne bema ne beden ebeda at least in premier sanko si in pregnant so na what be a bom ho ban sa for in fear bako and I say bosumi dumi no I mean 1 year is 12 months ti bosumi dumi no is after 1 year no na say no ma bobosi conditions ma bobosi omuti together sabi omudi nhyiamu se ne also omudi nhyiamu o abram bom ho ban use any form of contraception and na afis so no nhyiamu no so ye into so frequent at least 3 to 4 times a week sa afi bako na se nyinsa yamba na ne e bitimi aka se sa couple no amu ye infertile de e ka se obi ye infertile na se obi ntimi me because me the web obonini but for now essence ye ka twi ni ntima me ka se obi oboni a that is the basic definition idea there
obi a won't mengo won't mean nyensan na wa
awu no nti couple no because remember it should be a couple because it takes two to make babies two near oba any bema anti na couple no two oba ni bema tina so mo edampo we da ha we da na so mo ndi nhyiamu a eno so no nyensan ye dai intimate mba that's also a condition. And even po some mutina mudi nhyiamu no pokra no yesa say o say nhyiamu timi hyiamu empremian sankos ni nan so na wotwe bia at least 3 to 4 times a week. And I was saying kamatina says also for afebako. Into once all these conditions are mabobosi and I feel any kwa some bomb ho ban free nyensan ho. I mean you should not be using any form of contraception. But I say into once mabobo we nyina so na say mo ye we nyina mo mbo mo ba na bibia pepepe na nyensan ma de a and there's not our phone or me infertile. Tinity nyina no.
Dear ne man basa.
No ma bebre. Mami mao the normal because the normal physiology ne ini peduna se bibia pepepa de bisia manyisen etimi aba. Sa ye hu the normal na afi de media project akọ abnormal se na de beti ase e kwan fa so ni pantimi de nyinsen. Ansana oba
Capital Radio 97.1 FM so na wuti abo enwumre nsia
ebu enya normal cycle onso mo bu amonsa e kan say ebusun bi mo coach ma efichire sorry obu ni nsa they have to menstruate. The menses have got 4 phases
but okay
omo menses ni wo achichemu mi 9 phases 9 back when the first one ye baby a omo bu omonsa no that's the bleeding phase, that's the menstruation hono obaby betimi abunisa from 3 days to about 7 days depending on the cycles in the city. Sabre na obuninsa no na obane kosua na yawo ho no nsisa bi ye de ekoso because ho na ovary na ho na obetu nkosua na free enti every follicles ebra obuninsa na follicles no so start to grow because in the pedua na adwene mu no yawo no mebu o man yakopon de adua adwene mu every be hypothalamus every be pituitary many technical but just to appreciate what I also want to say. Ti amono so produce nuro bi eba ye mogya mu na be glucose an ba bia oba no tino kosua ne free no na no so start ensisan ye den eba obe produce bi e friend no follicle stimulating hormone na ama ba bia obetimi ato kosua free no ebe ka sa hormone ni ebe ma sa follicles na nyini na afi nyini so a na eboa na ma ba kwa be dead ya no ho den pa ye be to kosua ma kosua na den aba na sa kosua no time on beto kosua no sa phase your friend ovulation phase into your menstrual phase, follicular phase, then ovulation phase on the to kosua no baby ya na sa follicle na to kosua na no in subit me be different corpus luteum sa corpus luteum no be produce different progesterone na no so akọ awodi enim na akọ prepare awodi, and that's the luteal phase awodi enim nwira na ewo mu no na ye kama se na be ya so kosua na ya to no eni bema ho kwammo akohia na se e form moja motor as in it forms an embryo moja to na eye akora ne ba be to awodi enim na e be to awodi enim awodi na ya ready se be den be je you can say fertilized ovum na say moja to na form no se na baby time de grow kama on se city and for pregnancy to be achieved I was say no mama bobo so yi me kan the train tia won kakra but se me kan bro man ka be clear but mama kan the train so sa
oh yet ya say
no mama bobo so yi I was say each of them have to happen nti also oba no onya kosua ovia no ho ode betimi aton kosua afi so anya so oton kosua ne keke o oton kosua na e fa droben bu mu e friend fallopian tubes eho e na be ma no nkwamo no betimi ne kosua na di ahia mu na fertilization na den atake place na afi de nyinsen na asino abeta awodi enim so the tube should also be patent and functional na just say obano tubes no the droben na oton kosua ne fam no I was say mu da ho and yes mu da ho keke I was say timi so eye adwuma go ka say a tube is functional say nyinsen ne take place I was say timi movie you know the fertilized ovum into the uterus to propel it towards the endometrial cavity sene be ya piano now beto awodi enim that is the functionality of the tube of course apart from so no se beto awsa awodi no so mu ready I was in the city no I was say ready because awodi no say mu da ho I was say ndra na ewom no kama because remember say ndra na ewom no nya kama nyinsa ne betoma ebesai sa awodi enim asia nyinsa ne betoma de ebesai ebi wo ho ma ne bi wo ebe wo mo no na o ma awodi no ebe say e ma chemienu eni kwan say banisa ebu okwa ebe nko no ni awodi akra absent uterus ebi also more separated uterus they say awodi na nkasa so inseminate me ba ho obu also a obu no yare ebi ti say mamika bi ti say fibroid enye fibroid na the cause infertility but depending on where it is the location of the fibroid for instance say bia
ka fibroid an dey
no go from si akwan anti say twi mo friend si akwan osi akwan and I say I think osi akwan that's what my friend and so yeah one of the benign tumors ebeto awodi anima ebitimi say especially a dawodi anima nkasa na say bia awodi anima ebitimi aka awodi no emu tokro no the cavity no it can more or less distort the cavity and say nyinse nkra sia entimi ngina ebitimi adan apone mamen kan sa banye ni nyina na etimi ma nyinse ye den and I say nyina na si nyinse ho kwan because different types of it ebi wa awodi na bonten e wonachi ebi a subserosa no say unless a sopan na bibi and I say it's so huge enough to be able to compress or destroy the cavity but other than the subserosa ones will not cause infertility ebi so pedunculated and so awodi na bonten and also intimi cause infertility but the wa awodi ani mu no submucosal ones which are big enough to occlude the cavity and I say so pass a big cavity mega cavity awodi ani mu tokro no o senka kwa ho na akwa no koda no ebetimi akansi so yama nyinsa ne so nyede entimi nyede engina enti se obi ebenya problem ya na se one ne nkosu ato mu no sabi o oba me ka oba de sisi ebia ne nkoye 2 ne droben no so na oto nkosu ne panko se fam na nyinsa ne timi ba no eno so ebia na enkoye 3 awodi na ankasa na uterus no so o senka mu da ho kama na nyinsa ne timi betumetimi gina kama no ebia na no so nkoye apart from that awodi na no your friend of service you see the service also has a critical role to play because say you be mad in ho be call ba ho a be man nso no de go ba ho a be fa sa service nim anaso awodi na no nim na akosoro na ni kosia na kosia enti nyankopon so ne sada say service ni also produce fluid bia a friend cervical mucus and nso ekwan wo say thin I was say clear it shouldn't have any pathological element in there say be penetrable and say because a bit nyama nkwabo ano eden edwaria fam na ne kosua na den akodi ahye mu na nyinsa timi den aba nti so ba so abnormal cervical mucosa eno so betimi ama nyinsa ne nyede ntimi mba na cervical factor ba kono no. Unfortunately, the word I'm going to talk about enya common, but a man be also how many pediatric may produce every be anti-sperm antibodies or no any pediano who sperm now produce soldier for now acquire attack sperm now kuno a cool sperms nina that's what we call anti-sperm antibodies. I was in the city next cool sperms now sperms and also I didn't find them come you couldn't better know womb until the sperms will not become viable. So in the city no next after so that cervical factor no becomes critical. It is so oba infertile. It could be from the ovaries, it could be from the tubes, it could be from the uterus itself, it could be from the cervix. Even some cause right because ovaries no kwesa higher centers ovulatory factors like hypothalamic pituitary ovarian axis dysfunction. Maybe to say ya adwene mu no say because nyame de no ma bi adua adwene mu a eno nso produce inuro bi ko emoja ma eno na be sane na be gu yemoja na be minka sa be gu nkosua no ho na etimi ma no so ya adwuma se na wo say den on se na city no enti sano mo nyina okaboma ovulatory dysfunction, tubal dysfunction, structural anomalies of the uterus, abnormal cervical factors, all of them put together can make a woman infertile. In fact, if you cry common make us say the vagina should be receptive. They should not have any form of sexual dysfunction because maybe what say your condition for the vaginismus almost muscles now to me tight into me be my crying day in this year mumpuna pese be man ne hunsu na gunu ho ama enkwamo na timi akompone kosua na den akodin hia mu sa eno so ho nti no a mass afem no sa no ma
I just say be man entumi ne nhia kra.
Yes, because sabi na masekwana me hu sam me sia chemu otwie but the condition is vaginismus. Now almost walls become so tight say it makes penetration a bit difficult and hard for the man. Na say e basa so na say onu ntimi a sabi onko no ho a be dey di nsu na kogu baby o say egu na posa ayden akofra den akosro ani sabi o menka ne say kosua no akodi nhema amanyensia aba enye mankwa so.
Okay, what the yen twen e man no yen fisia ne yen kam man na sa ye beba mema no so echiri ntisane ma we a waken se ni nyina ekabo mu a ene ma ne basa se ba ko pe ena yes answer anu so betumi dia.
Yes, on say ubusam said no mabe neti mane ba enye say for some women a man be hono ma it could only be a tubal damage, one factor a bit many tube ne pe obani be also could be multiple factors. It could be a tubal factor, it could be ovarian factor, it could be a uterine factor, it could even be cervical factor. What you saying? The message can say obu bit me ade ba akopɛ na yɛdɛ ɛma ne ntimi yɛdɛ enyin se
sisi ni kwan
obu also bit me no ma yabobɔ so nyina emu mienu ana miensa ba ebi kura me nkase me I'm not exaggerating but ebi ko bit me akoba say oba bi an tinye bit me nyina. I'm yet to see that being in an OBGY unit, but the American senior and say bit me ba akopɛ e bit him so multiple factors. Mabe bossy no ma yamaka say timide infertility eba memo bent bit me multiple factors. And the victims were back up any dinipanina. For instance, if you are sabi obi enya ectopia here. Ni tube no ni same see, but answers and go back to the and go to the car tube nim. When yes, I'm you, you try tubes in me no fro. Because a pine moja you no gunumu, yan chani yan chicha, moja big no gunuma newu. Into a bilateral appendectomy, you need to remain in your fro. Only tubes. Purely tubal problem. I say, what about this? I won't only uterus, only I would dear cry.
Are you movie, sir?
Yes. We have only Mullerian genesis, we want only uterus or Tionosus or Benny. Never saw none. Oh, sir, I don't understand the technical, but the whole point is, I mean, sure, just be to say, there were several things. I said, Obusam saying, Timuba Kwana be brain. Anti ameso mekasa obu also a bia na ne nkosua no e ho atochema ne ya yeden yakoyi afiri ho
Then every man abasa. Then every man kusiano.
Maybe we have, for instance, say be a wenya ovarian ectopy. It's sad, it's so bad sad that we don't have a choice than to take out the ovary. We also be some tumor be an ABB. Yarabia be to kusiani ma baby or tun kusiani free. See any free why you meet me in Nako. If you are not calling a crack kuno, they'll say you free or and several things can cause the ovaries to be taken out. Enti a man dey no kwa dey complex chanya mema no because o hwe no mama bobo so ya o ba ne dey no enya ade ba ko pe o efi na wo dey na no ekwa wo dey enimu ekọ ne duro ba enimu ekwa akọ mpokosi bebi otunkosu afri ne nyina betimi a cause of what infertility in a woman as far as and also on top of that hypothalamic pituitary ovarian axis dysfunction so another malfunction can also cause that
yanko mema no so
e mema no so yes, you remember, yes, we did any. On say, yes, you will be a friend of hypothalamic pituitary testicular axis. The chain said, yes, you said, say, man, you are doing no maybe a honoma, a bitch chinsua. Na aba, na be a big goose be your balls, no, your bear, your testes, and then so stimulating them not produce come on a sperm. No, you produce sperm now, you will be a friend epididymis. Na sperm na costo as store sperm na my. So it is only oba dinchie mo a na sperm na free epididymis name na fa do ben be a friend of vast difference na any seminal fluid and seminal for your prostate produce bi nsuo na ye kikabom na be semen no na fi dia fa ye urethra mu urethra na be bia sebi ye ho nsuo no e fa ba ye efri be manim ba na akọ any oba na eden akọ ba no ho na timi ni menka ne say oba no enkwamo no kosia no akosia na nyinsa den aba na emema de ne grouping into three yewo pre-testicular causes yewo testicular causes and yewo post-testicular causes ne be chechem de me pese me kanya ne say pre-testicular no eye normally affect emma testis ne nya adequate support sine be ya ebitimi before the testis no or pre-testicular events are your testis no ebiti say obi involved in strenuous exercises, horse riding, motorbiking, or obi so say or a driver otina you can say car or two kwanya otina car mo di be our long journey. Oh no, all I'm saying is that temperature really affect your sperm production. Some of these guys, temperature becomes a risk factor for them. One of the pre-testicular causes. If we also sabi omonomo sabi brain, it's a pre-testicular cause. In sabi brain so nyama bema say intimi mo ma nkwamo an intimi inform ye. If you also are omofa nrobia itimi suppress the production of
you said Ruben
as me specific job, I mean generalizing no. You will say anabolic steroids.
And only day.
And me bu why I say opeswa macho. Na mako to tablets. Because say what and some of these are drugs which we have to be mindful of when we want to mention. One here, what do you need so the A2 for banu biso akoto de yen normal. But osmato me be say me macho kase pa me bo. The most format tablets be no me dey or more fat. San no ni bitimi affect the ability to produce sperm. And if you also so among so no sabi every be hypogonadotrophic hypogonadism. I'm saying me stand talking about and also say because I adwene mu no hypothalamus pituitary gonadal axis also boa me to produce be different testosterone na nka yetimi aboa me ya produce sperm no it's also to touch ma and also can be looked at as a pre-testicular factor. Entimi ma be ma nyinsai oba. Any what testicular factors? Any dear sebi testis na nkasa ne ho aka. And no testis no ebe produce low quality sperm and as a semen. Even though ebe nya some sort of good hormonal support near the but still semen e produce no. And I say in whose when I free Berman Hobano, and what dinner woman near day, our form. And no says a wound near not necessarily aging as a process, but when it's me affecting, but yet automatic. Two, yare bi etimi test bi te say varicocele hydrocele nsuo bi begina say bi obema bi o se bema ne ba ko ahono na asa ekese. It could be a hydrocele, it could be a varicocele. It can also affect testicular function when it comes to producing sperm. It will also have moms. Don't see a susano. Now, unkwesi akwara ne how honom se tea. Mom's viral infection. Yes, it say. And so massive. I'm just say again, one treat here. That virus can also, or it's also known to be a testicular cause of what infertility. A bit in summer, Bema. See when you've been treating the year. It's also been implicated as a testicular cause of or factor for infertility. It was what almost if it be cryptokidism and that's undescended testes. There may be a say, we are for now, you prefer my Miyama. Sebi, Yeshua Mabano. If you are not besnako talk, Yeshua sacking him. So, along that journey, if something goes wrong, the testes can get stuck along this pathway, either in the inguinal canal, either in the perineum, either in the abdominal cavity, wherever. Along that path now, say, if I better honor, be bitimi sina and queer, bitimi aka. Into Omega say on the Senate, and say, and to me, I'm a top baby, I was saying, a better. Remember, it will say free, your body never toss us, quarter sack, and send a beer, a better control, because remember, temperature plays a critical role. That's a heat. So, what's the deal? Heat, bapa. I want to say, you and run a cutter your boss, night day. Name my ha. Neboa. Now, boss, not a son from Kama. I walk bapa, not falls in a katana day, not a second, not society, actually, near day, a kosuka. It's a mechanism to make sure that always optimal temperatures are maintained around the testes so that you can produce adequate semen or sperm, in fact, sperm, under the right body temperatures. What I say? In Tisadi and so, but unfortunately, the testes in the Madrona Caniyam in Sanim Begum. That is the condition referred to as cryptokidism or undescended testes. Now, Bema Sabi, or Madraka, Yama produces sperm annual biodine, acrodicium, and also can also be a cause of infertility. Anyway, the last part, in fact, even the testicular cause some cancers, and I say some tumors, meaning cancers, per se, tumors or neoplasms of the testes, a bit in so cause be a testicular factor for infertility. Anyway, post testicular factors. There's an idea. Genital system no what produce will be but conduit now the econo. Some conduit that sabi it could be a problem with Obama, so it could be impotence because at the end of the day, Bema sabi Bema no Obama be shiamwa. I was saying kodi ne hunsu no could go obasi, but sabi so bi sabi Bema ninti me peja. If there is significant erectile issues and as erectile dysfunction and impotence,
the harder music.
And so you put up and say, oh, the idea. 2, if you are premature ejaculation says, Sebi Obano or so Beman and Sana when was an Sebi and the boxer shows him. I guess we only consult the good boxer and Yinsiaba. Also, the could go about and Sansan and Yinsay. Abba. It can be a post testicular factor. 3, we can have things like hypospadia. They may change say Obama Bia no Sebi. Ufa Obama na no I wanna ye Jones of fan, baby Jones of fan. That is the urethral meatus opening. Also, a Washington Sebi no sperm and as a semen no Sebi ye husani ya and as ye giant one faba. Unfortunately, ebi mu be pure no. Ebi mu de ba ase ye shaft and Sebi ye ben ase could be at the it can even come as far as between the base of the penis and the scrotum, pinoscrotal hypospadias. It can be just beneath the shaft. Next, instead of saying car, and there is so fast when I say a one no say we shoot you and straight and I'm and I say, well, I see how shoot you and find a beko down. It cannot be directed to where it's supposed to be. In fact, even apart from hypospadia, there's a variant of it, different epispadia, and the any nias and I was raw. And so since I think about Hano, that's why BP has saying, yes, I know, it need be also a day. This is always our problem, that's why it becomes a post testicular factor that can cause infertility. Again, you know, I said, can you to yourself, and you can say Banachi. Remember, unfortunately, be touch more on say, before I even say that, let me say that, put it in a proper context. For there to be function or appropriate functioning, there should be a convenient structure. What I say, anti-sabi, ufatu na to say pay so bullet ne konanim any kwase banachi fini bia wetime kuma boa. There's a condition we call retrograde ejaculation. Be mani tutu no inse senka nsuo no be konanim no sebi na yeden e banachi
ai ko hiva
ebegu na ebegu ne balls ne. So that retrograde ejaculation is also another problem, and it can be looked at as a post-testicular cause of infertility.
Say piba. Nti
I say bibia sine kwan. Nti wo yare no. So say nti me kan normal one na me kan no. When I say yare ho, problem ho no. So say nti then also becomes a post-testicular factor for causing what? Infertility in men. Sabi your average size penis. Sabi obi one dey kete micro penis. Intime nyahwe. Because kete no be sori abe simple na pese atimi akọ ba ho de sabi nkwamo akogu mama nyinsa eden atimi asi. I'm saying this no. And to sum it up no, when you pick up the male factor and say mema de intimi mayanya intimi obema intimi ni bench nyinsa intimi mba. It is these three broad categories of factors na maneba: pre-testicular factors, testicular factors, and post-what? Testicular factors. And sometimes to infections. You're careful. I think say for the sake say your discussion as you soon at the intino. You say it's important say you're not in the yare and I say hypocrisy in your infection is it if it's around our genitals where you come money memenina. You're careful. Because some of the infection can damage us. Some of the infections can really make us pay a huge cost in the near future. Why am I saying this? People have got significantly damaged fallopian tubes. It might be a infection, which is gonorrhea, chlamydial infections. Eventually, some infections in tubes. When you not your tubes not safe, intimate also call IVF. When you get such infections, you have to make sure it's well treated because there's a condition called obstructive exospermia, where a vast difference. Some of these infections can damage it. One treating you can get epididymitis from chlamydial infections and gonorrhea. One treating and hospital papa treating you damage some of these vital structures. Say some of these vital structures. To the extent in the near future, it can affect your fertility. There's some infections too. Apart from mumps virus, these infections too can also be a serious problem for them. And the last one, I think that make testicular factors, may be trauma. So your bear now so we tell me, ebia o bobo, ebia o ye we dia go be na bibi bo bear me now. It is a pain. You have be testicular torsion. I will say quickly. Hospital. It's a pain in Jaco. If there's testicular torsion, that's one do hospital within 4 hours. Near a new operation, near Yamawa. After 4 hours, you are likely to lose the testes. Now, say you see you be free while. I see you buy then, you could be a free hole. Wait me produce sperm now, Jaco in some about Debbie. And these are all things that is see, but essence be and young huninti young funny serious, but until a due time you been here, sir, vital structure see you been here in terms of your see ya worry you see a ninsania near the nafi don't say ninsania one in the ember you say yasam kasiaba na doctor obeko doctor be hweme say sa die we me and asam asem you see na BBC am years ago ntina akofa sa problem we nyina dey abrami. And those are the things that can cause infertility in a man.
Capital Radio 90.